Good afternoon, everyone. Welcome to the fourth session in the UCL Beyond Boundaries Conference on Global Inequalities in a COVID-19 World. My name is Karen Levy, and I'm Professor of Transformative Urban Planning here at UCL in the Bartlett Development Planning Unit, and I have the pleasure of chairing this afternoon. As you would have seen from the advertising for this session, we have three impressive panelists with us to discuss the session today. I'd like to just briefly introduce them to you, and so that we can get straight into the session as soon as possible. Professor Relebohile Moletsani is professor and the J.L. Dube Chair in Rural Education, School of Education at the University of KwaZulu-Natal in South Africa. Professor Amma de Graft Eikens is a British Academy Global Professor at UCL's Institute for Advanced Studies. And Professor Phoebe Konduri is the Chair of Sustainable Development at Athens University of Economics and Business, and the founder and scientific director of the Research Laboratory on Socioeconomic and Environmental Sustainability at that university. So the format that we're going to follow this afternoon is to address three questions, and we're going to take them each in turn and open them up one at a time for any questions that you'd like to raise from the audience. The first one is, how has COVID changed your thinking on the way urban, regional, national, and global actors need to act together to confront inequalities? The second one is, in some places, we have seen rapid direct action by communities and crisis responses from municipal and city authorities. What can we learn from these responses? And are we seeing new spaces and possibilities for long-term change opening up? And then our final question will be, what is the role of the academy or the university in supporting efforts to achieve the SDGs? So I'm going to start with the very first question. Can I move to Amma to address how has COVID changed your ideas or your thinking on the way urban and regional, national and global actors need to act together to confront inequalities?
Thank you, Karen. Thank you for having me. I think COVID hasn't really changed my thinking. What it's done is it's reinforced my thinking about the importance of community participation, equitable partnerships, interdisciplinarity, and efficient policy implementation. These are concepts that guide critical approaches in public health and global health, as well as policy communities interested in sustainable social change. The SDGs were developed and supported by UN member states precisely to address the multi-layered inequalities that COVID has revealed so starkly. I work on chronic diseases in the African context, as well as with African communities in Europe, and I'll speak briefly from this perspective. So before COVID pandemic hit, African countries were dealing with complex health crises, including infectious disease control, the rising burden of chronic diseases, the challenge of delivering universal health coverage. These health systems challenges were, intersected with major developmental issues driving the SDGs, such as poverty, hunger, unsafe work, poor education, gender inequality. And so there's been a long-standing consensus that radical structural reforms are required to strengthen African healthcare and social protection systems. In Ghana, one of the key problems in Ghana is that there's usually an extensive lag period between the development and implementation of policy, not just in Ghana, in other African countries. So for instance, in Ghana, current policies on mental health, disability rights, NCDs, took at least a decade to be developed and equally as long to be implemented. And even after policies have been sort of developed, the monitoring and the scaling up can take even longer, to be carried through, even if they occur at all. And so this sort of culture of discontinuous policy making, driven by power, ideological struggles between policymakers, politicians, development partners, has had an effect on the way that Ghana has responded to COVID. So as the country deals with COVID, for instance, we see the effects on poor communities with complex health burdens. I mean, I've worked with two communities in Accra called Jamestown and Ashertown, and throughout the COVID pandemic over the last 7 months, I've been sort of working with these communities, trying to understand how they're responding to COVID. And what we find is that, I mean, in the early days, they struggled, with, chronic disease care, but also material issues, money for medicines, for food. Older, disabled, people in the communities were particularly vulnerable. So what we saw, for instance, was how even though Ghana has policies around disability rights, around aging, active aging, around NCDs, these weren't factored into the ways that poor communities were being, the concerns of poor communities were being addressed. So I think my coming back to my issue is, we really need to think through how existing policies before the COVID pandemic can be leveraged to address the not just the medical impact of COVID, but also the social, the economic, the psychological impact. And I think any meaningful approach will have to push for implementing existing policies that intersect health equity, poverty reduction, and social protection.
Thank you so much, Ama. Relebohile, can I go to you now?
Yes, good afternoon, everybody. It's the same with me. The COVID hasn't really changed my thinking much. What it has done is to highlight and indeed make vivid some of the inequalities, or many of the inequalities that we've been observing in our work, in terms of just place and space. So the rural versus the urban, the periphery of the city versus the suburbs and the inner city, and so on. So we are learning from research that is currently being published by the big NGOs and foundations such as Save the Children working in South Africa, the Heinrich Böll Foundation, and others. For example, that COVID has sort of exacerbated the inequalities, and in particular for my work with rural women and girls, it has exacerbated their poverty and unemployment, as they lost some of the care and service jobs that they had in the neighboring towns and cities. And that linked to this, this has manifested in an increase in violence against girls and women in their homes, but also in the communities. And that this includes sexual violence and a huge increase in femicides, largely by intimate partners. What COVID also has highlighted is the ways in which these inequalities are not only skewed against women, they are also systemic in nature, and also intersectional. For example, in the case of South Africa, that it is the poor Black and rural and township women and girls who live on the margins of communities in our society that have been negatively impacted by the pandemic is not really surprising. And so COVID has intensified the already existing injustices against these groups and communities. And linked to this is the idea or the realization or the confirmation that place-based and the place-based and contextual realities of the impacts of the pandemic need to inform any programming that emerges out of our experience of the pandemic. I don't really have much faith in our government's policies, because for the last 24 years, we've seen how policies made at the top do not really address the needs of communities at community and home level. So maybe I should stop there for now.
Thank you, Relebohile. Could I go to Phoebe?
Yes, thank you very much for having me in this really interesting and I hope mobilizing event. The pandemic for me has proven a government's ability to take dramatic measures to mitigate an existential threat. It has also proven the people's ability to adapt to new restricted lifestyles imposed by these measures. It has also shown that national states are better equipped to respond to the epidemic compared to international organizations in terms of explicit imminent response. And of course, it showed that timing, it's proven that timing of the enactment of measures is crucial for their effectiveness in saving lives. COVID also revealed the depth of global interdependence. The world has proven to be only as resilient as the least resilient country and person. And we've seen that there is widespread social and economic and environmental vulnerability. And I think we should take this moment of crisis as a moment of clarity that must be used effectively to reboot development towards a people-centric, inclusive, rights-based, participatory, and green development envisioned in 2030 agenda of the United Nations and the 17 Sustainable Development Goals. Lately, I start on my speeches by saying that we are simultaneously facing three big tsunamis, one bigger than the other. The first one is obviously the health pandemic, which is costing lives and is putting a big pressure on our health system worldwide. This pandemic, however, is creating an even bigger tsunami of the economic recession that is causing. And this recession, it's a big challenge for us because it is important to try to make the effects of the pandemic, the duration of the effects of the pandemic, not too long outlast the actual health crisis. So we need to manage the economy and the society. We need to keep people into employment, even if we have lockdowns. We need to help the vulnerable in the society, because obviously the pandemic is hitting on the vulnerable country, the vulnerable groups in the society. We need to support SMEs as not to go bankrupt. We need to support the financial system as non-performing loans are mounting. And of course, we need to come up with recovery plans at least equal to the GDP loss during to the recession caused by the pandemic in order to reboot the economy. And I think it's important at this moment to see what we have in place. And what we have in place in terms of a strategy to face these two tsunamis, but also the third biggest tsunami that is currently relevant, climate change, is our sustainability related policies. At this, it is important to understand that the pandemic might be caused by climate change because of deforestation and loss of biodiversity that brought together people and wildlife and made it easier for the zoonotic virus to make the cross species live. And we should also recognize that climate change and extreme weather events are already affecting the economy, but are all, the economy of each and every country in the world, but also affecting, causing lives in each continent. So my proposal here would be to look at what sustainability policies we have. We have UN Agenda 2030 and the 17 Sustainable Development Goals. We have the Climate Agreement. We have the European Green Deal and the other announced Green Deals, South Korea, Canada, a green recovery plan, Israel, America, the presidential candidate of the Democrats has committed to an infrastructure green recovery. And of course, China has committed to climate neutrality by 2050. So we have all these green deals, and we also have a number of recovery plans that are climate and digital mainstream, and we need to take this moment to reboot our economies better, make them sustainable, but also reboot our societies to become more resilient. So attempting to, I'm finishing with this, attempting to face each new crisis with the same thinking that gave rise to the crisis itself will not give us a solution. We need a fundamental transformation of the economic, social, and financial systems that will trigger exponential change in strengthening social, economic, health, and environmental resilience. And that is why I think we need to think big. We need to change our systems. We need systems innovations. Thank you.
Thank you so much. So folks, whilst you consider perhaps some questions to put to the panel, I'd just like to sum up, which in a sense reflects, some of the comments very much reflect my own position. I think on the whole, the panel doesn't feel that their views changed much, but that the pandemic has highlighted many of the inequalities and the realities that they're dealing with every day in their work in one way or another. And indeed that men and women on the ground are dealing with every day in their lives. And some of the themes, I think that interesting themes that have come up are, first of all, this notion of global interdependence on the one hand. And I think that this has been such a powerful message of the pandemic. And on the other hand, the panel itself, in terms of their responses, have also demonstrated the context specificity of places, of the reaction of what's happened in different places. And so, for example, on the one hand, we've had some people talking about the positive, active role of national government. On the other hand, there's also been discussions about governments that haven't acted very well, and some reference to discontinuous policy making and the impact of that on the COVID process more generally. And I think also what has come out of our discussion is a recognition of the complexities of inequalities that we're dealing with. And I would argue that a lot of those inequalities are largely misunderstood or misrecognized by much policy and planning. We're talking about deep structural inequalities, as has been noted, in local and global systems of production, consumption, and distribution, and these play out on the ground. I'd just like to pick up a couple of other comments that I thought were really interesting. Amma's comment about the complexity of the health crisis in Africa and how that plays out in inequalities that we're dealing with. And the same was reflected in Relebohile's response about the impact on the lives of rural women and girls in South Africa. And I think that this also reflects Phoebe's identification of the economic side of the crisis in the pandemic and the impact and the crisis in that. And in particular, I just wanted to point out the impact on the informal economy, which for many cities in Africa, Asia, Latin America, and the Middle East is the place where the majority of the urban poor work. And indeed, with the majority of women, they're overrepresented in that sector, as we know. And we also know that the impact of the pandemic has wreaked a lot of havoc on the earnings and livelihoods of people in that sector. And yet that is also the sector where actually very little reaction, people could really not respond to government policies like lockdown, which didn't really make much sense in the lives of those people. So I think that in this really some really interesting issues to pick up with, and I just wanted to end on something that struck me in what came through in both Amma and Relebohile's comments, which reminded me of something that a colleague that works with me in my network on one of my research projects said, that actually the lives of many poor people can't be so clearly divided into the before and after the pandemic, because actually their everyday lives are very crisis driven anyway, and it's not so easy to separate the before and after. Obviously the after is more intensified and more, there's clearly a crisis emerging for people. But I think that what everybody has highlighted is the very real inequalities anyway that our system and our world lives with on a regular basis prior to the pandemic. The pandemic has simply overlaid another layer of these inequalities. And I think that also, if we could move into our next question, some of you mentioned specifically direct action by communities. And I think this has been a really interesting response in the pandemic, in the research that I'm involved in. So the question is, in some places, we've seen rapid direct action by communities and crisis responses from municipal and city authorities. What can we learn from these responses? And are we seeing new spaces and possibilities for long-term change opening up? And perhaps I can go to Relebohile this time first.
For me, while the emergency responses have indeed been necessary, one could say, I think, as Julia Smith observed in her research on the responses to the Ebola crisis in West Africa, we need to avoid what she calls the tyranny of the urgent. For example, in South Africa, the response has been largely an economic response, and to a large extent, the biomedical response, which has tended, as I have observed, to obscure the personal in much of our governments and institutional responses to the pandemic, and thereby ignoring the unfolding humanitarian and personal crises that are currently unfolding in families and homes. Just to illustrate, with the geographic and spatial segregation of communities by race, at least in South Africa, and social class, and the overwhelming reliance of people, mostly women from low economic income communities, on employment in care work, in service sectors, and as Karen has just reminded us, in the informal economy in most cities and towns. The COVID and the lockdown restrictions have been devastating, as can be expected for most families, especially those that are headed by women. In the case of South Africa, most families are either headed by women in rural areas, because men tend to migrate towards the cities to look for employment and so that they can send home monies for the sustenance of the family. So most families rely on income by women. So the COVID restrictions then has meant that these women who are responsible for, sometimes for large extended families, have no access to that income that has been otherwise available, albeit on a small scale. So, for example, another example is that for those people who tend to commute to work in cities and towns on a daily basis, the loss of employment becomes a reality during lockdown. Also for the middle class suburban families, it has meant loss of service by the domestic workers and service workers who serve them in these cities, and closure of businesses so far. And so far, the policies have in my view, tended to assume a very urban and often a very middle class population in the country. Whereas, as we know, that is not the reality of South Africa and Southern Africa more broadly, as far as I can tell. Thank you.
Thank you so much, Relebohile. Phoebe, would you like to come in on this?
Oh, sorry, I was muted. Community responses, and I will, my work is mainly focused in Europe, but also we run projects in Africa, Asia, the US, and Australia. Community responses have been there. And this is, I think, an attempt to use whatever safety net is available outside governmental response, and probably hedging against governmental inefficiencies, inabilities, in order to safeguard the existence of people, because this is an existential threat. So we see many community responses where you have communities that are more affluent and more mobilized. I would say we've seen a lot of solidarity, especially in Europe, and especially in more affluent areas of Europe. And I think this is where we need to start, from these self-organized community responses, sometimes enabled by the public sector, sometimes being completely private, that organize themselves in a way that identify the specific problems and are able to provide solutions, short-term and maybe medium-term solutions in order to support the community. This is where we need to start to see that people are willing, when they understand a particular problem and when they feel the problem themselves, to come in, engage in the solution, co-design the solution, and also co-develop the pathway towards the future vision that they have and want to see implemented. And this is exactly the approach we suggest as a way forward, as a way of recovery, as a way of rebooting our socioeconomic system after this pandemic. What I'm trying to say is that we need this systems innovation approach where all the relevant stakeholders are engaged in the process of creating a common vision, and then they are also engaged in the process of co-designing the pathways that will lead us to this common vision. Such an engagement needs understanding of the problem. The pandemic is a problem that is easy to understand and it's immediate. I suggest that my wish for this point in time would be that we don't only face the pandemic problem. And as the previous speaker said, we don't have the immediate response tyranny over the longer run. I want us to be able to build public-private partnerships that have the capacity to solve the pandemic problem, to respond to the pandemic problem, but at the same time build back better a resilient and sustainable world. This is what I want to see, because if we build back just the way we were before, wounded from the loss of life and wounded from the deep recession, again in a public debt crisis, because all the recovery funds are mainly funded by public debt, then we are going to fall into the next pandemic or the next big crisis that again will destroy our system. We need to become resilient, and we need to become resilient not just in the short run, but in the long run. So resilient and sustainable. And at this point, it is important, in order to become that, it is important to increase awareness, to increase capacity for this transformational change. So it is important to align our education system and our reskilling and retraining system with the needs of the society today and in the future.
Thank you. Thank you. Amma, can I move to you?
Yes, thank you, Karen. I mean, before the pandemic, there was this sort of conceptual model, which was used really for NCD prevention and control. It was the idea of the whole of government, whole of society approach. And that sort of concept has been used in various sorts of sectors, particularly in the African context, but I'm hearing it a lot in the global health space as well. And coming back to Ghana, which, where I've done quite a bit of work over the last few months, the whole of government, whole of society approach has kind of driven the responses, at the national level, but also all the way through to the sort of the grassroots level. I mean, one of the things that became really sort of apparent, and it was, the role of African scientists in the response to COVID. So we had scientists in Ghana, in Senegal, in Nigeria, and South Africa, essentially sort of researching the patterns and the trends of the pandemic, as well as developing tools for testing. And this became sort of big news really on the continent, but also sort of in the global media. I mean, even before the scientists sort of came in, we had sort of grassroots movement, seamstresses and tailors sort of sewing masks, groups basically, galvanizing action, taking care of vulnerable groups and so on. But we also had this sort of rise of civil society groups advocating for gender inequality, youth employment, disability rights, healthcare access, and so on. I mean, I was struck by how in April, for instance, when Ghana had just sort of emerged from partial lockdown, but there were still restrictions in place with worship, with sort of religious worship. We had a coalition of sort of evangelical churches using the label of whole of government, whole of society to push the government to open up churches for worship, basically saying, religious organizations are also part of this sort of label and so on. I mean, one of the key things that I think, has emerged as we have looked at the trends over the last 7-8 months is that even though, on the surface, there's sort of rapid action, there seems to be social engagement and so on, social responses have been bottom up as they have been always. It really hasn't been by invitation. If you look at the ways that sort of committees and programs and advisory boards, are set up in Ghana and other African countries, you begin to see, you see the similar sort of issues around exclusion. So I think it's important for us to interrogate who gets invited, right, to the fight, to address COVID. Who participates and for how long? Because as we move into the next phase, the phase that, my co-speakers have mentioned, the economic, the social, the psychological sort of phase, we really need to think about participation at all levels. And I'll talk about this in 3 ways. First of all, historical factors show that even in moments of crisis, you do need participation from all actors. In the community that I've worked in, as I mentioned earlier, Jamestown, Ashertown, they've been at the brunt of all the sort of the health crises that you can think of, starting from the 1918 flu pandemic, which killed 100,000 Ghanaians in the colonial era, through to seasonal cholera outbreaks, to the HIV/AIDS pandemic, to various sort of infectious diseases that arise from flooding. So you find that vulnerable communities have always sort of battled with various health crises. So when you ask them, what do you think about COVID? They say, well, it's a problem, but it's a new problem that adds on to the whole gamut of issues that we have to deal with. So that's number one. The second thing, for instance, is vaccine resistance. Now, this is a global phenomenon. It's not an African issue. I mean, there are lots of communities around the world that have misgivings about whether they'll take the vaccine if a vaccine is developed. But in Africa, history matters because, you have the general tendency to sort of be skeptical about vaccines, for instance, but that's layered onto a history of sort of mistrust, distrust around sort of medical intervention. So we've got to think about that. And then finally, we've got to think about real kind of radical structural change, because you see, grassroots protests are vital and they're important, but they can't, for instance, solve widespread intergenerational poverty. So it's important, for instance, that we think about, again, how do we implement equitable policies that have been there? I mean, in many countries, in South Africa even, there are policies that have been there for years, for decades. How do we implement them? We need to push for implementation of equitable policies in ways that, can sort of support the most vulnerable in society, but also in ways that allows us to interrogate those who hold power and hold them accountable.
Thank you so much. So I think if I could just add a dimension here, because in the research that we've been doing, actually, communities have often been extremely proactive in the pandemic, even when governments haven't been there at all. And we have extremely interesting and quite brave initiatives, building on existing community structures, which have been deepened and extended in this response to the pandemic. But I think the question that you raise about, well, but will these same people get invited to the table when we move into the next phase is a really important question. There are some very interesting questions coming up from the audience. And this is something that all of you've touched on in some way or another, and it's pretty fundamental. The question is, when trying to rewrite the economic, financial, and social paradigms, what tools are available to us besides traditional, in this case, they're talking traditional voting in elections, but I could extend that question to, the traditional tools that we use. You made reference, Amma, to the prevention and control models. I mean, what methodologies do we have actually, and as well as political processes, to answer to confront these issues? And in a sense, when in answering that, I would ask, could you take that on board and try and link it to the role of the academy and the university in supporting these efforts to achieve the SDGs, because I think they are linked in some ways. So perhaps I can start with you, Phoebe. You're on mute. You're on mute?
Yes, I am unmuted now. So the new words for me are resilience, sustainability, solidarity, capacity building. These are the new words that should prevail, and an umbrella word that would say transformative systems, transform our system. So our blueprints are the Sustainable Development Goal. Everything is in there. And the 6 transformations that the United Nations Sustainable Development Network, that I am honored to chair the Greek Hub, and also honored to chair the senior working group on the energy transition and the implementation of the European Green Deal. So we have the 17 SDGs. They tell us, they are our blueprint for the interaction between the planet, the people, and their prosperity, the prosperity of people, but achieving a sustainable, resilient interaction with nature. And we need a way to implement those. The way that we have until today, the way measured by GDP and not well-being measurements, the way of top-down approaches is not relevant anymore. The new way is an inclusive, participatory pact with the different layers of the society, a bottom-up approach that is combined with the top-down approach and allows inclusiveness, participation, and co-designing of a future vision and the pathways towards this future vision, technological pathways, policy pathways, and portfolios supporting these pathways towards their implementation. This will allow us to be participatory, but also have a systemic transformation of what is there. Transforming our system is important in order to get on a resilient and sustainable path. Linear changes, incremental changes will not be enough. We need to act, and we need to act quickly. We need to accelerate a change, because the pandemic effects cannot wait, the recession effects cannot wait, the climate change effects cannot wait. So we need a systems innovation approach However, in order to what is crucial thing as before, what in a fair transition, a transition to sustainability resilience that leaves no one behind, you really need to create capacity. You need people, the general public, and the civil society, and the businesses, and the NGOs, and the policymakers, and the politicians, everybody, to understand what this change is about. And we said it's about the SDGs and the 6 measures of transformation: health, education, sustainable cities and communities, sustainable management of food production, land, sea, and the ocean, sustainable decarbonization, and of course, digitalization. These 6 transformation pathways needs to be understood, and also, so the education system should be restructured towards this aim. We also need an education system that embraces interdisciplinarity and multidisciplinarity, not work in silos, and at the same time, reskill and retrain the labor force. We are going through the 4th industrial revolution. The pace of technological change is aggressive, is very big. We need this pace in order to timely respond to the crisis that we are facing. But in order to be able to use it, we need a relevant pace on the reskilling and re-educating and retraining our workforce and our youth. So this is one important, and I think the biggest challenge of our time. We've never faced such a big need for aligning our training and education system with such a technological pace. Thank you.
Thank you very much. Relebohile, would you like to add your view on the role of the academic or university in supporting these efforts and talking to the question about the need for changing paradigms?
From my observation, at least in the immediate South African academic community, while there are really wonderful initiatives going on in universities, with a few exceptions, for example, including in our case, a program that focuses on sustainable rural development. Most of us don't even think of the SDGs in our curriculum decision-making or research planning. So I think that programming in universities and research institutions should at least attempt to reflect a direct or explicit focus on the SDGs in terms of teaching, research, community engagement. And what we need are interventions that are multi-layered, deliberate, in their focus on achieving the SDGs. So for example, sorry?
No, go ahead.
So in our curricula, where we prepare young people for contributing to the well-being of their communities and the world beyond just preparing them for employment, a focus on the SDGs, especially conscientizing young people about the inequalities and the injustices of these inequalities and how they might contribute to addressing them might be one. In our community engagement and research, alongside the immediate imperatives of COVID-19 or disasters brought on by climate change, we could prioritize these structural issues that produce or exacerbate the inequalities. I'll just make one example from our research in rural communities and the lessons that we've learned so far. where we've been implementing participatory or taking a participatory rural development approach to working with girls and women in these communities. The first lesson that we've had is that unearthing the direct voices of these girls and women enhances our understanding of the issues peculiar to the context, and therefore are likely to inform a more efficacious programming. The second lesson is that these voices become useful tools for further engaging the broader community and the decision makers in these communities in understanding the issues, but also in imagining alternatives to existing programs. And the third lesson is that community engagement and policy making facilitates the development and acceptance of contextually relevant and targeted interventions. For example, in a community that is ravaged by early and forced marriages against young girls, the process that we used was able to enable the development of a community protocol and accountability for addressing these early marriages and forced marriages. And so I think that any programs must be informed by the experiences and voices of the people in these communities, and therefore their active participation, not only in the development of the interventions, but also in informing policies, and that universities must be at the forefront of modeling such approaches.
Thank you so much. And Amma, could I come to you?
Thank you, Karen. So I think the question was, how do we sort of rewire, how do we rethink sort of economics, social paradigms, but also what do we do beyond voting? And I think, you know, the first important thing is how we think about governance, and also how we sort of think about participatory governance. I mean, every public health crisis amplifies existing inequalities that raise disease risk, morbidity, and mortality, particularly for marginalized and vulnerable groups in society. And I think COVID-19 kind of sort of presents an extreme case study of this phenomenon. But the other thing which the question alludes to is the way that COVID is also revealing the inner workings of political systems and power, right, to wider communities. So, and one of the ways in which I think wider swathes of people are beginning to understand how political systems work is through the reach and influence of social media and the significant increase of civil society actors and voices, you know, in the public sphere, really in the virtual public sphere, but also in ways that now it's not, you know, the virtual public sphere intersects with the physical public sphere in very interesting ways. So take, for example, what's happening in Africa. At the start of the pandemic, there were very catastrophic kind of projections about, you know, the impact of COVID on Africa and so on. You know, I think some global health actors predicted 300,000 deaths in Africa and so on. Obviously, that hasn't come to pass. But what we actually see is that governments are using the low kind of impact of COVID, you know, as a smoke screen. So it's almost as though, because we've been very, you know, active politically, we've been able to drive down the rates of COVID. At the same time, this sort of phase of political complacency is showing existing problems that existed before COVID. In the last few weeks, for instance, you know, we've learned about, you know, grassroots movements in Nigeria, in Congo, in Namibia, in South Africa, Ghana, Ivory Coast, all relating to elements around the SDGs, right? So child rights, women's rights, youth unemployment, right? And disenfranchisement, structural violence, and all these things are happening even as governments have been applauded for their brilliant COVID response. We need to sort of think through that. And secondly, if we come home to the UK, for instance, civil society groups, social media sort of activists have shown us how structural inequality works, or how structural racism works in the UK context, and how that intersects with health inequalities. So one of the things that we're learning, for instance, is how, in a way, sort of civic education, participatory governance is being taught from the ground up, starting from social media, for instance, conscientizing people, and so on. And I think universities have a lot to learn from that. First of all, obviously, all of us have talked about interdisciplinarity, multidisciplinary partnerships. It's really important that, beyond the epidemiology, the public health, we bring in the social scientists, we bring in humanities scholars, we bring in social policy scholars, we bring in legal scholars at a very, very early stage. The second thing, I guess, that we don't talk about enough is methods, the methods through which we do our research. Obviously, COVID is going to be with us for the long haul. So we need methods that allow us to track what's happening, not just medically, but socially. So for instance, methods from anthropology or methods from social history become really, really critical, important tools for us to understand what's going on, how we work together, how we understand the issue as we move into a more complex sort of multidimensional space.
Thank you so much. I think in many ways we have responded to some of the points coming up that you can see on your screen from the audience. I think that in general terms, most of our speakers would say that COVID has really, in a sense, built on existing inequalities and not necessarily created new inequalities, but has exacerbated many, many inequalities that exist in our societies. I think that at the same time, I think what we're talking about in terms of, I think a number of interesting issues came up around what universities could be doing in terms of creating the next generation, not only of community, people living in everyday lives in the community, but perhaps also the next generation of policymakers and planners with a deeper understanding of questions of inequality. And I think a theme that's come through extremely strongly in the session today is this whole question of intersectional identities. Almost everybody's talked about gender, about class, about age, about disability. In other words, the intersectional character and the diversity of communities, which, if we're going to do anything real for change, has to be recognized in the way that policy and planning is thought about. And I thank you for raising the question also of methods. And I think that this is also relates to the issue of paradigms. I think that there is a really important message there for universities, which is not only around thinking about what universities could be teaching in their curriculums and how they could be teaching them. I mean, how do you actually teach a multidisciplinary curriculum? But also the question of really looking and questioning our own academic universe, which in itself contains many inequalities, and to rethink the way that we do research, perhaps working more openly with partnerships with equivalence, promoting knowledge co-production methodologies, and really opening up our own world a little bit more, and seeing it as part of the inequalities that we're talking about. So folks, I'd really like to thank you all for a very enriching conversation this hour. I feel like we could talk another whole hour quite easily. And I feel quite sad that, that I've been given a warning in terms of time to finish off. But I'd like to thank our three panelists today for raising a number of important issues. And I would like to say that I know some of the questions that came from the audience were a lot of questions about what do we do about, and how do we do this? And I think those are really important questions. But I would also say that in order to get those questions in view well, we do need to understand and diagnose our reality as it is. And I think this afternoon's session has brought a very rich lens to the inequalities we are facing globally in different places, and the way in which the COVID crisis has really, in a sense, latched onto those inequalities and deepened and widened them in many ways, and providing us with an enormous challenge for the future, but one that is obviously going to have to be have to address multiple ways of addressing it, multiple levels of governance, multiple disciplines brought together, and clearly to bring together some of also the very big issues of our time, as Phoebe said, you know, bringing together questions of not just the pandemic, but also the economic crisis and the climate change crisis that we face. Thank you so much, everybody. Thank you to the audience. I'm sorry we couldn't get to more of your questions, but I hope that they were addressed by some of the comments that everybody made. And what we can see is that the audience definitely thinks that we have to fundamentally change our approach to tackling world inequalities. That is absolutely clear, and I would expect that. So thank you, everyone. Take care, and look forward to seeing you in session 5 of Beyond Boundaries UCL's conference. Thank you.
Thank you, Karen.